My name is Ameya Kulkarni, and I am an interventional and congenital cardiologist at the Mid-Atlantic Permanente Medical Group. So one of the things that I am most proud of about our cardiology department and the way we do things is the way we view the patient's problem as our problem. We have built all of these systems so that for the patient, it seems that the time from when they notice they have a problem to the time that the problem is solved is as short as possible. A couple days ago, I was on something called the heart phone, which is a phone that a cardiologist carries 24 hours a day that every clinician in our organization has access to. One of the primary care doctors in Woodbridge called and said they had a patient who was having chest pain on exertion. They came up and by 10:30 we did the stress test. The stress test was positive, and so that meant that the patient needed a heart catheterization to figure out what was going on with them. So I called my colleague at the hospital who was ready to accept the patient. So the patient drove over to the hospital, got their procedure done by about 12:30 over 1. We did it through the wrist, they got a stent, and were home and slept in their own bed. So the time from when they noticed they had a problem and saw their primary care doctor to the time their problem was solved and they were back in their own bed was a business day. And just to give you an idea, in the community, the standard for the first visit, so the cardiologist visit from the primary care doctor, the average in Washington, D.C. is 16 days, and that's just for the first step. And we were doing end to end in a business day. If I had chest pain or exertion, or my dad had it, I'd want that speed of care. And so that's what we do.